Welcome, everyone, to this edition of Aging with Attitude, the show that deals with topics that are vital interest to older adults. And I'm so happy as your host tonight. My name's Keith Dennis, and I'd like to introduce my guest tonight, Marie Warren from Gentiva Home Health Services.
Thank you.
Gentiva, Marie, I'm so happy to have you on the show. I'd love to have you just share a little bit about your service and a little bit about what you do.
Well, we are so appreciative of being on your show today. As you know, their senior population is growing, and many people want to remain in their own homes these days. However, different medical challenges may mean that they need assistance to remain in their home. So I wanted to talk a little bit about what services are available to older adults in their home to help them stay there as long as possible.
Well, I want you to go ahead and just start. I'd love to hear more.
Well, there is a little confusion, and there are two types of home health services, and so I wanted to clarify that first. There's a non-medical model, and the non-medical services include such things as housekeeping, meal preparation, transportation, medication reminders, those types of things that enable somebody to stay at home from a custodial standpoint. But what we're going to be focusing on today is the skilled home care services, and these require the services of a clinically trained person, such as a nurse, therapist, social worker, and so on. So that's where we'll focus today.
Okay. Now let me ask you this: who would need these types of services, and when would your service come into importance?
Okay. Thank you. Any type of person age-wise could potentially utilize home care services, but we are going to be focusing on the senior population in what I'm referring to today. Most commonly, we may provide home care services for someone when they're discharging from a hospital stay. They may have been there for a procedure or an illness, and so home care will be coordinated for them to help them as they transition back home to continue that recuperation process. And the value of the home care service is that it's a support to that family member as well as the patient themselves, and helping them understand what they need to continue that healing and strengthening process and prevent them from going back to the hospital, which nobody wants. They may also access care if they had to make a short stay at a skilled rehab facility. These are more commonly used these days after a hospital stay when the person is not quite ready to go home. And so the same situation would arise in that home care could be set up at that point. We commonly will also see patients that have had falls. And 1 in 3 seniors in any given year will have a fall. Other people, they might not have fallen, but they're at high risk for falls. There's a lot of things that affect the risk for falls, and those might include various medications that people are on. As we get older, we have more diagnoses that we're trying to deal with. We have environmental factors that can affect falls. Your medications that you're on, you could have eyesight changes that might affect your ability to see and therefore put you at risk for falls. And many of our seniors, you'll notice, are using assistive devices now, maybe a cane or a walker or a wheelchair, or carrying around oxygen, and any of those might also increase the risk for falls. So that would be another common use. And lastly, we have patients that just have chronic disease. These people might have respiratory issues, they may have cardiac diagnosis, they may be diabetic. And as you all know, that these types of patients have to really manage their disease, including the medications they're on. They may have special diets they're on. It's very important to get exercise or activity. And so we're working with them to help them understand how to manage, to learn warning signs when things maybe are going downhill and they want to catch those early before they get back in the hospital. So it's a lot of education involved with those patients.
Well, yes. Now, I'm interested in hearing about what types of services do you actually do?
Okay, a little more specific.
A little bit more specific,
yes.
Yeah.
A lot of what we do is education, and it is a one-on-one with the patient, And it can be a team approach. So we, as I mentioned earlier, we have nurses, therapists, social workers. Nursing component will do things such as reviewing medications, and med reconciliation is very, very important because people oftentimes get confused about the medicines they're on. They maybe have been changed at the hospital or at the doctor's appointment, and they're confused about which medicines they should be taking. So that's a very important aspect of what nurses do. They'll also do a lot of education regarding their diagnosis, particularly those chronic diseases, to help people understand the changes in lifestyle that are important for them, and understanding, again, those warning signs so they don't get into trouble. We also do such things as catheter management, and some very high-tech services can be provided in the home, such as infusion for antibiotic therapy, or tube feedings can also be done in the home. So it runs the gamut from education to very skilled services. We do employ physical therapists. Physical therapy, you think a lot of times after people have had maybe orthopedic surgery, that's very common now for our seniors. People with strokes or Parkinson's, they need physical therapy to help them strengthen, relearn and how to use those muscles in a more efficient manner, build up their strength and endurance, and help them with fall risk. We do safety evals in the home also. Occupational therapy, I've often thought is a funny name because we're not talking about people going back to work, but we're trying to help them be able to do their activities of daily living, things that you and I take for granted. You're bathing, you're dressing, things around the home, being able to prepare a meal or do their laundry. So working with them on doing those practical things that allow them to be as independent as possible. Sometimes that might require adaptation, maybe reorganizing their area in their kitchen or their bathroom, maybe obtaining some assistive devices to help them do that more safely and easily. We employ speech therapists, and many people think of speech therapy as just speech production, particularly maybe after someone had a stroke and learning to re-speak. But it also involves swallowing, which is very important when we're eating or taking our medicines because we can aspirate if we don't swallow properly. So very important in managing their disease and preventing pneumonia. And thirdly, the speech therapist can work with cognition. So sometimes if people have had a stroke and they're relearning, or people in early stages of dementia, that they can work with them and their families on coping mechanisms and way to work around that. Two of our ancillary services also are social workers, and the social worker is very involved with helping people identify community resources that would be helpful for the long term. Things like Meals on Wheels or applying for Medicaid or finding transportation, those types of things, as well as long-term planning for families that may be looking at having to move their loved one into another living setting or making plans for advanced directives and those types of things. We do have home health aides that help out short-term with bathing and dressing, but again, that's very short-term use of our services.
Well, I know that in my own personal situation, my mother is 96.
Wow.
And thank goodness she's been allowed, I guess through the grace of God, to live that long without needing an awful lot of assistance. But, you know, she's at a point where, you know, the health care that she gets now on occasion, she does have somebody to come out because she's not as able to take care of the situations that she finds herself with. So she has someone come out. And what she tells me is just having that company and feeling comfortable that there's some person that really knows what they're doing.
You're absolutely right, because particularly seniors, they become isolated many times. They're not able to get out and drive or able to just get out of their homes as much as they used to. Their good friends are passing away or maybe have relocated to be near family members, so there's a lot of isolation involved. So it is very important for people to have that contact, and sometimes having those either paid caregivers coming in or the home health care workers, it does help them with that service and help them understand the need of having that social contact. And it's an extra set of eyes on them that maybe family member's not nearby, or they're not aware of some of those little warning signs that a trained professional might pick up on and be able to get help in a timely fashion.
Right. Now, let me ask you this. I guess, this is skilled care that your service mainly provides. What kind of vetting do you do to make sure that you have the best?
Great question. All the clinicians that we use have to go through state licensure. They are drug screened, they have background checks. We go through that entire process, and of course we're licensed and bonded so that people are safe, feeling comfortable that the people coming in their home are who they are. We try to have the same clinicians going into their homes on a regular basis rather than switching off all the time. So they develop that rapport and that friendship many times with their clinicians. A lot of times we'll have people, if they repeat our service, ask for the same people again. But the beauty of having them through a company is that if, say, one of our clinicians was ill or had a family emergency, there are other people to back them up.
Sure. Well, I think that would give our audience or anybody that's interested confidence that this is a proper approach, and also that you're doing this in the home. And I think for my mother, her worry of having to go into a nursing home has driven her to try to stay away, and thank goodness she's been able to. But we're so grateful for the services that your types of services that Gentiva provides can do. I guess what maybe for our audience we'd like to talk a little bit about, does Medicare and other insurance cover such home care?
Absolutely. Very important. We're so fortunate in that Medicare can cover our services 100%. There are some criteria that are required for the patient to meet. The first is that the patient is homebound. And what that means that it's a difficult and taxing effort for the person to leave home. It may require the assistance of another person. They can get out to go to medical appointments because we need them to get out to their medical appointments to see their doctor. They can go out for worship service or briefly maybe for a haircut or something like that. But pretty much during that time, they're homebound. For some of our clients, that might be very temporary because they've had a procedure, maybe a knee replacement or a heart surgery, where it's just a short-term homeboundness and they're going to be back to their normal routine before long. And some of our patients, homebound is going to be a long-term status for them. We do have to have an order from a physician and a physician following that patient. So it's very important that the patient is seeing a doctor on a regular basis. And I cannot stress how important it is for our seniors to have a regular doctor, and if they don't have one, to get one, because our services and many other things are driven by having a primary care doctor. So it's very, very important for them to get established with a doctor that knows them and can follow that. The services that we provide under skilled services are intermittent, which means that we come and do the skill and then we go to our next client. We're not staying with them for several hours, which is a staffing model.
Right. Mm-hmm.
There are other insurances that will cover. Medicaid can cover the service. VA benefits can cover home care, and some in private insurances will also cover. Their benefits will vary based upon the policy, and it's our task to screen that policy up front and make sure what the benefit is that the patient has if we're in network, and then what limitations that they might have for services. Medicare does not place specific limits on the services. It's based upon medical necessity and that doctor's order, which is a wonderful, as I say, benefit for our senior patients.
Well, I believe you mentioned briefly, but I understand, and if I'm wrong, let me know, but I believe that you said that you'll help them work through how to perhaps do some of this, or at least point them in the right direction.
With the insurance?
Yeah.
Yes, well, they will need to have a payer up front, but many times our seniors may find themselves at having to look toward Medicaid for their long-term payment, and we can, with a doctor's order, help them learn how to get started in that process for applying for that. Another great resource for patients, not through us, but is through the SHIP program with North Carolina, that can help them identify what type of care plans are available for drugs or other coverage, and it is a free counseling service that is available here in Charlotte.
Okay, well, we've had them on our programs a number of times, and it's a wonderful resource, so I'm happy to hear that you point them
Yes.
in their direction. So,
Absolutely.
Again, you've talked a lot about all the different services. Again, what other choices would they have otherwise?
Well, Medicare requires that a hospital or rehab center offer choice to the patient as far as what agency that they can choose. And Medicare dictates that the patient has the right to choose which agency they want as long as that agency can provide the services that they need. So it's very important for patients to understand they have that choice. A lot of times they haven't used one before and they really don't know, so the hospital should offer them a list. And most doctors' offices have several options that they know of that are available that they can offer patients. Many times, though, that doctors will develop a certain rapport with an agency because of the comfort of knowing the staff and their expertise, and will many times maybe recommend somebody, but it is up to that patient to choose the one that they prefer. And one thing I do want to mention I forgot to do earlier is that our services are available not just in their own home, but we serve patients who live in senior retirement communities, assisted living communities. Also, patients in those settings may receive home care services. So they may be transitioning from their own home to that setting, or maybe once they've been there, there's some additional needs identified, and Medicare would still cover the services in those settings.
Well, that's all very wonderful information for our audience, but I'm hearing you and I'm listening and I'm hearing a feeling that you have this passion for doing this. And I guess I'd love to have you just share a little bit about anecdotes of things that you feel that over the years, and maybe stories that some of your health providers have given you about the interaction that you have with the seniors.
I think you're right. I've been in home care for many years, and from a personal note, last year my mother had a stroke and received services from our location in the Raleigh area. And I really came to understand on a different level the value of the services that we provide, because it is that education and that follow-up with that patient. And actually the speech therapist identified a blood pressure issue with my mom when she was treating her and got that responded to, so we didn't have to make an emergency visit. So from that perspective, I'm very appreciative of being knowledgeable about the services so that when my family member needed it, I knew what to ask for. You're right, there are so many families out there, and it's sad that sometimes we'll get a referral from a doctor's office and the patient will refuse the services. And I think it's because maybe they're scared of somebody coming in their home, it's something different, and they don't understand that Medicare can pay for that. But there is just so much out there that people don't know. Understanding, as I mentioned earlier, about their medications is so vital, because sometimes people have the same medicine with different names in their home. Maybe they've been prescribed and they got a generic version, and then they have the name brand, and they don't realize they may be double dosing. They may have over-the-counter drugs or vitamins that might counteract the needed work of the medication that the doctor has prescribed. So us going in the home and actually looking through medicines. We had a patient years ago that had a suitcase full of vitamins. And you think about the money that person spent on their vitamins that may or may not have been doing them any good, and may have been counteracting each other and the prescriptions that they were paying for also. So it's just those kinds of little things. And it's very comforting for the families too, to feel like they're overwhelmed, particularly if you've got somebody coming home with a new diagnosis, they've had heart surgery or they have a wound, and the family's like deer in the headlights. They're scared to death how they're going to manage at home, or an elderly spouse trying to take care of the other spouse. So having that skilled person coming in that's working with them one-on-one and reassuring them, and being available by phone at night or weekends or holidays if they have a question, being that resource for them, so they know they're not just out there at home by themselves, that we're part of their healthcare team working with their regular primary doctor or their specialty doctor, depending on what's going on, that we're all part of the same team and working together to help them understand how to progress.
Well, I imagine the number of the people that you serve are people that have probably outlived at least 2 or 3 doctors, at least maybe not outlive them completely, but that the doctor has come up as a young person and has retired, and then they have to get a new doctor.
Yes, you're right. Or people, a lot of Charlotte area particularly, we have a lot of people have relocated, so they've changed doctors because of that, or their doctor's retired, as you mentioned, or with a little bit younger population, maybe their insurance plan changed, and so they had to change doctors from that perspective. So it is a challenge sometimes, them getting used to that new doctor and having that comfort level. And so hopefully we can help bridge that gap for that patient and their family.
Well, again, I would just say that, at least from my mother's standpoint, she is so happy that she is still living in her own apartment. Not that everybody can do that. Right. But ultimately, the services that you all provide, not your service in this particular case because she lives in Austin, Texas, but that's similar. And again, that coming in, I can't state how important that really is in terms of just being there and being a person that will see her on a regular basis, just to be chatting.
Exactly. Well, and you made a good point too, being Texas, Gentiva, we're a national company, so we do have locations throughout the United States in 40-some states, over 500 offices to serve clients throughout. So I've had several occasions where maybe somebody was here in Charlotte and was transferring. I had a patient go to Seattle, New York, Atlanta. So it's nice for the families that they can get that service arranged here to go somewhere else, or if that family member moves to go to be with another family member, that may be able to be transferred within our same company.
Absolutely. Well, I see the continuity. Having continuity is extremely important, and just in terms of making a person more comfortable as they move, because it's frightening if you have to move and for whatever reason. So. Well, again, you've got people that go into the homes. Any other stories that you'd love to share with us or could share with us in terms of things that their staff and some of the things that they report?
A couple of quick things I might mention about our company in particular is that we do have some specialty programs. One is Safe Strides, our fall prevention program. And the beauty of Medicare coverage is that it could be a patient that has not yet fallen but at that risk. We work with physicians on that particular program, and then also our cardiopulmonary specialty, which is focused on your high-risk cardiac disease, your COPD, pneumonia, those types of diagnoses that likely could end up back in the hospital. So those particular specialties have very evidence-based treatment programs that we have developed within our company. We train our clinicians specifically to those programs, so a new clinician has to be trained before they could treat patients within those specialties. And then we track outcomes on those patients because we want to be able to demonstrate that what we're doing is actually working. And we have shown, particularly with our cardiopulmonary program, our rehospitalization rate is below the national average, which is very important to us as consumers and to Medicare because they're the ones that's, well, we all are paying for it through Medicare, right. So it's very important as one of the focuses of Medicare now. Same thing with falls. Falls can be very costly to the patient and their family and to the healthcare system. So if we can do things to help minimize that risk and help people learn coping mechanisms to avoid a fall in the future, that's a win-win for us all.
And you were talking about the pulmonary. I think that for older people, the risk of pneumonia, developing pneumonia, is extremely high, especially if they're not getting the regular service in terms of. So if you can go maybe into details about a little bit more about the pulmonary.
Sure. We do a lot of education with the patients in that program, talking again very much about their medications, about breathing exercises, energy conservation, to help them learn how to break up tasks so that they can do things without getting so tired and worn out, and really just keeping an eye on their symptoms so that they understand when they're starting to get in trouble and they can respond appropriately, getting in touch with their physician office. If we're involved, they get in touch with us, or if certain warning signs, they know they need to call 911 and get to the hospital. So helping them learn those different risk factors and how to respond. to hopefully catch things early and keep them minimized.
What is that process like? I mean, in other words, how do you know that they're...
Well, we actually have a teaching tool that we call a zone tool, and it has red, yellow, and green on it. And if you're in the green zone and the different items that are listed there, you're managing your diagnosis and doing well. If you start seeing the items that are in the yellow zone, you know you're getting in that warning area and you need to contact your doctor or contact your home health professional to follow up and see what needs to be done. Is it, meds or whatever that might be done? And then if you're in that red zone, that's when you need to call 911. So we have those zone tools that we use for a variety of diagnoses to help our patients learn how to respond, and as a reminder when they kind of get anxious that, yeah, this is the time that you need to take action.
Well, again, we've covered so many different things. I want to make sure that I give you an opportunity. What have I missed? I'm sure I've missed something.
Well, as we've talked a little bit about before the show, that Gentiva is a national company. We invest a lot of time in education of our clinicians, in developing specialty programs to hopefully be on the front edge of disease management. For example, our cardiopulmonary program and our Safe Strides, because we know these are problems that occur over and over and are costly and cause people to go back in the hospital. So we spend a lot of time and effort on educating our clinicians and looking at those different tools that we use to test for our Safe Strides. We have some different tests that we use in the home to help them identify their risk assessment. We use other teaching tools to help patients learn better. So constant reinvesting in that education process is very, very important.
Well, I've so much enjoyed having you on this show, and I hope that our audience has learned something that they can take away in terms of their care, in terms of a long-lasting life that will continue to improve, or at least maintain their ability to stay, your ability to stay in the home. And again, we want you to continue watching our show. And again, Marie, thank you so much for being here. And if I also want to add that we do have a channel on YouTube called Aging with Attitude. We'd love to have you go out and take a look at those things. And again, join us again when we air our shows. We do that on the second and third Saturdays at 8:30 here on Cable Access. Thank you so much for being with us.